Hello friends. So I was just revising traction. So I thought while I was revising it, just make this video and to share this with you all. So why do we need traction? And why we apply it? So whenever there is a breakage in the continuity of the bone, we call it fracture. And whenever there is fracture, before doing the operation stage, before in the pre-operative stage, we use the traction part. Why traction part? In those patients who have any kind of the fracture. So why traction is important? As it is helpful to release the tension between the broken bones. So this is the bone is like this. It's like a straight line. So whenever there is a breakage, so now there is different connectivity between two bones. Here the extensor muscles and the flexor muscles are in two different positions. So these two directions, any movement in these two directions will cause pain. So now initially we have to release the pain until the patient is not taken for the surgery. So how do we release the pain? By giving analgesic to the patients and by applying the traction apply करके it will give a force in the two directions. It immobilize the broken part and it release the tension between the two broken bones. So now we have applied the tractions. It released the muscle spasm and it immobilized, and it is helpful to realign the broken bony parts. That is why the traction is important. Now the other thing is कि patient traction पे है, तो what all things we have to watch for. हमने बोल दिया कि पेशेंट हमारे पास फ्रैक्चर की हिस्ट्री लेके आया, डॉक्टर ने उसको बोल दिया कि आपको ट्रैक्शन लगाना है. हमने ट्रैक्शन भी लगा दिया. वो हमने क्यों लगा दिया? हमने बोल दिया टू रीअलाइन द बोन, टू इमोबिलाइज द बोन and to decrease the muscle spasm or to decrease the pain. So now the assessment parts, the three major assessment here we have to do is the neurovascular assessment, skin breakage assessment, and the other one is we have to look the patient's alignment. So in the neurovascular status we will check 5 P's. These 5 P is very important. First P stands for the pain. Ask the patient about his pain status, whether we can do this by having a facial expression or by asking the patients from 1 to 10. He can select the numerical numbers and he can tell us his pain status. Second P is the pulse. Check pulse bilaterally. अगर इस पाँव में या हाथ में फ्रैक्चर है तो आप इस हाथ का भी पल्स चेक कीजिए, इस हाथ का भी जो ब्रोकन बोन है उस पार्ट का भी, एंड चेक इट्स इक्वलिटी. Monitor for any difference. So second is pulse. Third is poikilothermia. Poikilothermia assess the extremity, whether it is warm, whether it is cold. So third one is the poikilothermia, and the fourth one is the paralysis. Ask the patient to move the limbs, to move the fingers, and the fifth one is the paresthesia. Pinch the toe, fingers, or the broken parts, and ask the patient whether he is feeling the pain while pressing or pinching the fingertips. So assess for the sensation. So these 5 P's, the pain, pulse, paralysis, paresthesia, and poikilothermia, is very important in any patient who is having the fracture and who is on the tractions. The second is the check the alignment. आपने पेशेंट को बक्स ट्रैक्शन लगा दिया, स्किन ट्रैक्शन लगा दिया, उसके बाद हमें पेशेंट का चेक करना है द अलाइनमेंट. पेशेंट शुड बी इन सुपाइन पोजिशन. In supine position, patient should be straight. You can elevate the head of the bed, should be elevated 30 degree, and the weight जो हमने पुली और ट्रैक्शन जो अप्लाई किया है उसके साथ पुली के साथ और जो weight है, it should be hang freely. And the rope should not be tangled. It should also be straight along with the patients. So this is the alignment part in which we will check the patient position, that is supine and straight. Head of bed should be elevated. elongated, the weight should be freely hanged, and the rope should not be tangled. Next is skin assessment. As there is fracture, the patient is not able to move, we have applied the traction. So in this part we have to assess his backside, his sacrum size. The traction part, assess the traction site and the location for redness, itching, or any other problem, the pressure which can cause, and monitor for the early signs of the infections. Any kind of blister can be there. So this is the skin part. So this is all about the traction. Thank you so much.